RAP uses trained peer facilitators to help people struggling with addiction or mental health challenges develop recovery plans, recognize problems earlier, and respond to crises. Both programs underwent clearinghouse evidence review process and met its evidence-based standards. The clearinghouse exists to review research on services intended to strengthen families and prevent foster care. Now we are putting federal support behind them. By adding these programs to the clearinghouse, we are giving states another pathway to claim federal reimbursement for qualified prevention service through federal program. It's about identifying what works and then expanding it and letting the states take advantage of it. And we want more states to follow Iowa's lead. This announcement also advances President Trump's Home for Every Child initiative. We want a country where homes are waiting for children and not children waiting for homes. But the best way to reduce the number of children waiting for homes is to prevent unnecessary family separation in the first place. When addiction threatens a family, helping a parent recover can also protect the child and make sure that the family stays together. That is where the Great American Recovery and A Home for Every Child come together. Since President Trump launched the Great American Recovery Plan, we have announced more than $1 billion in funding opportunities. But success is not measured based upon how much money Washington spends. We measure success by results: are people recovering? Are children safe? Our family is stable. Are people returning to lives of purpose and responsibility and community? Those are the outcomes that should drive federal policy. We will support approaches that produce those outcomes, including peer support, community organizations, and faith-based organizations that have helped Americans overcome addiction for generations. Government cannot manufacture recovery, but we can demand evidence. We can reward results. We can give states better tools to help people recover before addiction destroys their families. And that's what we're doing today. We're expanding federal support for proven peer review programs. We are giving states new tools to address addiction and strengthen families. And Iowa is once again leading the nation in putting those tools to work. Governor Reynolds, thank you for your leadership, and thank you to the House of Mercy and Rebecca for welcoming us today and giving us that wonderful tour. And thank you to my colleague and friend Catherine Burgum and Alex Adams for their leadership on this effort. Now we want the states across the country to follow Iowa's lead, and I'm going to present my colleague and my friend Catherine Burgum.
Thank you. Thank you, Secretary Kennedy. I'd like to just follow up on the Great American Recovery and thank President Trump for his bold leadership in wanting to make big changes across America to help Americans who struggle with addiction and mental health issues. I'd love to also recognize Governor Reynolds for, of course, being the first to do this important program related to family peer support, and also Secretary Kennedy for his leadership really changing the landscape of behavioral health, nutrition, and much more across America. So I know a lot about addiction and recovery because I've been in recovery for 24 years now. Struggled with addiction for 20 years, didn't reach out for help because of the stigma. I was out walking one day, didn't know what to do. A voice said to me, maybe you should ask for help. And so I did. I said, I don't know if anyone's there, but I need help. And I have been sober since I uttered those words. That was divine intervention in my life. And then, after that, I became First Lady of North Dakota I had 15 years of recovery. I hadn't talked about my recovery. So I just decided I have to start talking about this to help reduce the stigma. So for 8 years, that's what I did as First Lady of North Dakota. What we did in North Dakota related to peer support was so important, like this family peer support program that's happening here in Iowa. And what Iowa is the first in the nation to do this work. So I often wonder what would have happened in my life if I would have had someone with peer support, lived experience helping me, and available to help me. I'm so grateful to Governor Reynolds to create this program in Iowa, to create this opportunity to keep families together. You know, there's 113 million people impacted by the disease of addiction across America, and they're impacted by someone else's addiction, and that includes a lot of children. So anyway, I just want to say 3 words. Congratulations, Iowa. Actually, more than that. Congratulations, Iowa, and Governor Reynolds.
Thank you.
Oops.
Good afternoon. My name's Alex Adams. I'm the Assistant Secretary for the Administration for Children and Families. I'm thrilled to be back in Iowa, so thank you, Governor Reynolds. I'll start off by saying, President Trump said it best when he said the best foster care system is one that is not needed in the first place. If we can support families, if we can wrap around families and prevent entry into foster care in the first place, you save the trauma from both the child as well as the biological parents. Anything we can do to accelerate prevention and access to prevention services is something that we're going to be looking at very, very carefully at ACF. As Secretary said, we've got an evidence review process, and based on the peer-reviewed research that is out there, we're thrilled to add peer support as one of the tools in the tool belt that states can add to their prevention plans. As has been the case on many things, Iowa is the first, but hopefully not the last state to amend their prevention plan to include peer support. So what ACF is doing today in conjunction with this announcement is we're providing template language that any state, any of the other 49 states or the district can use to copy and paste into their state prevention plans so that they can unlock these evidence-based, valuable services for parents all across their state. As the Secretary said, by adding it to their prevention plan, we make federal funding available and help offset state costs for providing these prevention services. Probably the most important thing, though, is that when something is added to the Prevention Clearinghouse, it's not income-based. It can be available to any family who has young children at risk of entering foster care, regardless of their income. It is a powerful tool that Congress unlocked through the Family First Prevention Act. At ACF, we've been adding as many tools to that toolbox as possible, but ultimately it is up to states to walk through that door. Thanks to the leadership of Iowa for being the first. And with that, I'll turn it over to the gentleman who submitted the plan amendment that we have approved as of today. So without further ado, Principal Deputy Larry Johnson from the Iowa Department.
Thank you, Assistant Secretary Adams. You've been a breath of fresh air, and your partnership and leadership has been truly appreciated here in Iowa. Thank you, Governor Reynolds, for your leadership and the clear, compassionate vision you've brought to strengthening Iowa's child welfare system and behavioral health systems. And Secretary Kennedy, thanks for coming back. Your team is just amazing, and we really appreciate your commitment, President Trump's commitment to helping Iowa find better ways to support children and families. I would also like to thank Rebecca Peterson and the House of Mercy for the work they do every day to serve Iowans and families in need. We're grateful for your partnership, for your work, and know you stand ready to deliver important services. I'd also like to acknowledge today, as we are talking about families and behavioral health, 2 members on my team who have just been so critical, Division Director Janae Harvey of Family Wellbeing and Protection, and Marissa Ianson of Behavioral Health. We just have incredible teams that do incredible work each day. And today we're putting the commitment we have here in Iowa into action. Last year, caregiver substance use was the reason almost 3,000 children were removed from their families and placed in foster care, and around 9,000 children were victims of child abuse involving a caregiver who uses substances. These numbers tell us something. They tell us that we have families in need, and we need to meet those families where they're at with the support at the right time. Family-based recovery brings intensive, clinically sound substance use treatment and recovery support directly into the homes of the parents who need it. That matters because many parents face real barriers to traditional treatment, unreliable transportation, unpredictable work schedules, life. This service is designed to meet families where they are in their homes, on a schedule that can work for them and with them, and with the intensity of the support they need. Caregivers will receive treatment and recovery support while also benefiting from intensive parent training. And importantly, children can remain safely in their homes while their parents receive the help they need. That gives us an opportunity to address the underlying reason a family came into the attention of our department without separating a child from their family when it is safe to do otherwise. We know substance use disorders are common and they're treatable. Recovery is possible, and we want families to know they are not alone. Family-based recovery can be a beacon of hope, healing, and new beginnings for Iowa families. With this addition to Iowa's service array, we can bring treatment and recovery into the homes and work to make sure families are better off because we knocked at their door. This is Iowa's commitment to recovery, and family preservation looks just like this. Thank you very much. And I'd like to introduce Rebecca Peterson from House of Mercy.
All right, thank you. As we conclude today's gathering, I want to take a moment to express my sincere gratitude to everyone who's contributed to this important conversation about family-based recovery. First, I would like to thank Secretary Kennedy and the federal HHS team for being here today and allowing us to be a part of this important announcement. Your insights have helped deepen our understanding of how we can better support children, parents, and families facing complex issues and challenges. I also want to thank Governor Reynolds and the Iowa HHS team for your leadership and commitment to advancing innovative, family-centered approaches to care. What excites me most about bringing family-based recovery to Iowa is that it allows us to reach families earlier, before substance use becomes severe, before a family reaches a crisis, and before a parent and child have to be separated. House of Mercy has been doing this work since 1988. For nearly 4 decades, we have understood something that is at the heart of family-based recovery. When a parent struggles with substance use, we cannot treat the parent without treating the whole family. That is why our work has always gone beyond treating just the addiction. We use evidence-based practices and family-centered care in all that we do because we know that these relationships matter. The early years of a child's life are critical, and those everyday moments are building the foundation for attachment and emotional development. Family-based recovery gives us an opportunity to protect that foundation instead of waiting for families to come here in our treatment facility after things have already fallen apart. We can go to them before it becomes a crisis, in their homes, in their communities, and in places where family life is actually happening. And that is what makes this opportunity powerful. We are not simply treating substance use. We are helping parents recover. We are helping children thrive and giving the families an opportunity to heal together. So House of Mercy is incredibly proud to bring 40 years of experience serving families to this work, and we're excited about what family-based recovery can mean for Iowa. And now I'll turn it over to Governor Reynolds.
Thanks, Rebecca. It's all I can do not to call her Rebecca. I've known Rebecca for a long time, and she has been making a difference for a really long time. So just thank you for everything that you and your team do to help Iowans overcome addiction and keep families together. I also want to thank Larry and his entire team at HHS for their leadership and commitment to building a stronger, more effective system of care for children and families. As you've heard, substance use is the primary reason for children who are removed, the primary reason that children are removed from their families and placed in foster care or become victims of abuse. But substance use disorders are treatable and recovery is possible. And that's why today's announcement is so important. So through the partnerships with HHS, I was proud to be the first state to formalize our commitment to delivering family-based recovery. And as it has been said, it just gives us another tool to really support families before they reach a crisis. So I think it also reflects the broader work that we're doing through the Great American Recovery to make sure that Iowans have access to prevention, treatment, recovery, and the support they need for a better future. So again, all for being here, being a part of this, and just making a difference every single day. I mean, I can't tell you what a blessing it's been to work with this administration and this team. Your get-it-done attitude is making a difference in the lives of people across this country, and we're really proud to be a partner in that. So thank you very much. And with that, we'll go ahead and open it up for questions.
Please remember to keep your questions on topic, project since we don't have microphones for you, and state your name and outlet very clearly. Let's go ahead to Kay first.
Kay Henderson with Radio Iowa. How will you determine the household is eligible for this program? Will it be a mandatory reporter, a social worker, some sort of court intervention?
I'm going to have Janae come up and answer that, but I think one of the things that the Assistant Secretary mentioned that's really important, or do you want to address it?
I'll start.
Okay, you go ahead and start. It's not incomplete, so I just think that gives us a lot more flexibility than we've had before.
So under federal law, for somebody to be eligible for prevention service funding, the family has to be determined to be a candidate for foster care. So it must be someone with a child who, but for this prevention intervention, the child would be eligible for entry into foster care. There are no federal income thresholds, which I, again, would reemphasize as one of the most important parts of this. So it's not just targeted to Medicaid-eligible families or others. So as long as it is a candidate for foster care, the family could be eligible. States then have the ability to set state-specific definitions for what they consider to be a candidate, and the Iowa team would be much better to address what specifics they have here in the state.
It's up to 5, I think, but I'm going to let Janae answer that. Yeah, so families are going to be determined eligible. They need to come through a child abuse assessment. So somebody would have reported them for suspicion of maltreatment. We would have a child protection worker who goes out to meet with the family, interview kids, and if we determine that there's a substance use disorder at play, we would then be making a referral to the family-based recovery. There's currently outpatient services for substance abuse recovery. There's inpatient. I know this is kind of a nice hybrid where service actually goes into the family to bring that treatment right into that living room. I think that's the biggest part of it.
Dave, do you have a next question?
For the First Lady, can you talk about how you've chosen to go public, right? Everything, and now you're in advocacy. Can you talk about how do you convince others to make that choice? Because everybody talks about you got to overcome the stigma, right?
Yeah.
But standing up like you all are doing in front of a microphone, if you've been through this, is not normal. But that would be a big portion of this, right? To make this successful, to get these kids and the families in here and all that stuff. So how do you get over that hump?
Right. Because stigma prevents people from reaching out for help. So with the Great American Recovery, we are looking at addiction as a chronic disease. That alone will eliminate some of the stigma because, if it's a chronic disease, you treat it like all other chronic diseases. And addiction is a lifelong, chronic, relapsing brain disease. So eliminating the stigma is a huge part of this. And hopefully that means that families that are in jeopardy of having their families, torn apart because of substance abuse, chronic disease of addiction, they'll reach out for help. It should be, we just have to change our medical system so that, there is no stigma related to this chronic disease. The stigma has to go away. It just cannot be part of it. So I believe the minute, we blanket America with a message that this is a chronic brain disease, things will change.
Asia Garland, Local 5 News. When will families in Iowa begin to see this new program take effect? We're planning.
Okay, yeah. Well, there's a little bit of planning that goes into the process, but we've submitted it, signed off on it. We actually are the first, so it's been approved. So that's the first thing. And then the team will get to work and start the good work of implementing the pieces of the program that will start to make a difference. But I can't just reiterate how important it is to be able to go into a home and be able to help a family and do everything we can to keep that family intact. I mean, that's a game changer, and to get in on the front end and not the back end. So I'm really excited about this new tool and the difference that it can make. And it's really just complements the things that we've been doing over the years. And I think this is a really good next step, and it'll continue to make a big difference. So, and today's question, I'm 26 years into recovery, and I've not been shy about sharing my story. And I think it's important. Calling this a chronic disease as it is a game changer. It's not a choice, but I think, by me sharing my story, hopefully that gives other individuals the will to ask for help, and that's where it starts. When you realize that you can't do it on your own, and when you're used to really managing most of your life, or thinking that you're managing most of your life, not always the case. You don't understand why you can't also manage this, and you can't, you need help. And so hopefully that message will continue to resonate with Iowans and Americans across this country, because there's so much hope out there, and recovery is real, and it makes a difference. And I didn't realize life could be so good. So
let's take our last question from the back, Theodora. So this question's for Larry. You mentioned the 3,000 kids. Is that all in Iowa? And was that
last year.
This last year?
Yes.
Yeah. That was last year's statistics.
Thank you guys so much.
Thanks for being here. Appreciate it.